We've got something a little different tonight for Living St. Louis. Actually, it's a lot different. Health officials told us it was coming, this new kind of flu, and now it's here. And they made it clear we needed to take this seriously, as individuals, as families, and as a community. So tonight, we're all about the flu. Ruth Ezell's in the studio with a lot of questions for some of the people who are dealing with this public health challenge. But we begin with Anne-Marie Berger's story, which is not so much about policy, it's about people.
Each Wednesday evening, you can find me teaching an oral communications class at Florissant Valley Community College.
So that you do things a little bit differently?
A little bit, like...
The class is a mix of full-time students and part-time students. Many work full-time jobs and often more than full-time jobs. There are quite a few parents of small kids and school-aged children, and a few of them even work in elementary schools. If the flu hits any one of them or their children, their lives can get very complicated. But are they ready?
Do you guys have any idea what you would do if you came down with H1N1? Do you have any plans in place? Would your household stop? Would you be able to go to work, and would you be able to maintain your grades if you all of a sudden were out for a week?
I'm quite sure you wouldn't be able to be functional. You would have to literally shut down. You wouldn't be able to go to work, school, or whatever. You'd basically be bedridden.
If I got it, what would I do with my kids? I mean, I wouldn't want my kids in the house with me, so now I got to try to find someone that would even take on 2 boys for a week or however long. I would be sick.
If I don't have the time to take off, then I'm not going to get paid regardless as to what the situation is.
Oh God, how am I going to pay that car note because I missed a week of work, so
Right, yeah.
I mean, I am sitting here like thinking, man, what would I do?
What do you do if your child gets sick? What are your options?
Everyone's talking about this H1N1. With this going around like this, I think I would just take her to the emergency room.
And I was just like, oh God, please don't let me get sick from everybody else, coughing, because you don't know what they have. And I was a little nervous just sitting up in the hospital because everybody was just coughing.
H1N1 is so prevalent. Has it changed the way that you all are going about your everyday business?
I do not touch doors and knobs. I always use Kleenex and napkins, and they tease me a lot.
Spray a lot of, Lysol everywhere. And they always tease me at work and say, here she go with that can again, because I'm spraying everybody. If you come in there coughing, sneezing, I'm spraying. As you standing there, I'm spraying.
Not a lot of people are exchanging the peace at church on Sundays either.
Do you worry about other kids coming to school that are sick?
Yes, because some people, they just send their kids to school. They may not have the option of staying home.
My concern is the vaccine is so new. It's like, is this really gonna help you, or what other side effects does it have, or what other, risk is involved?
I would just do it for the sake of my daughter, because she has allergies to eggs. She can't get the flu vaccination. So I would take that risk for her, because if she gets sick, then it would be detrimental to her health.
I'm just hoping and praying that I don't, because I gotta cook, I gotta come to school, I gotta go to work, and I gotta be the backbone for my children and my family.
Good evening, I'm Ruth Ezell. The story you just saw by Anne-Marie Berger raises some of the issues we'll address during this Living St. Louis special. My guests are deeply involved in fighting the flu in the St. Louis area from different perspectives. Dr. Jeffery Lowell is a professor of surgery and pediatrics at Washington University School of Medicine. He also serves as senior advisor to St. Louis Mayor Francis Slay on medical affairs. David Reddick is communications director for pandemicprep.org, a consortium of businesses, hospitals, schools, government agencies, and other entities. And Jan Polizzi is a registered nurse, a member of the Missouri Nurses Association and Nurses for Newborns. She's among dozens of nurses in the state who provide health care and education through home visits to families. Now, before we start our conversation on the flu, you should know that operators for the United Way's 211 service are available if you need help finding a clinic or other site where you can seek treatment and where flu vaccinations are or will become available. If you're calling from a landline in either Missouri or the Metro East, dial 211. From your cell phone, dial 1-800-427-4626. The operators cannot give medical advice. For any specific medical questions you may have, contact your doctor. Information on the flu can also be found on our website, ketc.org. Welcome. Thank you for joining us this evening. As you know, President Obama declared a state of emergency late last month because of the flu, and at last count, at least 114 children have died from H1N1. What is the situation right now, starting with you, Doctor? What is the situation right now in our area?
Well, a lot of people have it, and we haven't seen the worst of it yet. Every day in the city of St. Louis, more than 1,000 children are absent, and we presume much of this is due to H1N1. Our best guess right now is we are running about 6 times last year in terms of the incidence of flu when we compare November 2nd to November 2nd, 2008.
Okay. Now, Jan, you go into people's homes. I mean, you are on ground zero as far as this is concerned. What are you seeing? Are you seeing a lot of sick people right now, or people that are concerned about getting sick?
I see people that are concerned about getting sick, and we've actually had to change one of our protocols for visiting because I have to call the patient the night before, and I have to say, are you exhibiting symptom A, B, C, or D? Because I haven't received the vaccination yet for H1N1, and so I triage a lot more over the phone before I even get out to the person's house. And if the family is asymptomatic, I'll go ahead and pursue with the visit, but I'll have to do a lot more phone triaging now. And also we have nurses that are out with the flu, and so it's crimped our staff. So we've had to change a little bit more of our policies in the way of our outreach, and I've been really, really working more. My focus is prevention. If I'm in the home of a family that is asymptomatic, I am stressing prevention, signs and symptoms of what's going on with the flu, what to be looking out for. And I have some babies that are cutting teeth. And so I'm doing some instructions with the family. This is what you could see with teething. Teaching them again, monitoring the temperature, looking for poor color around the lips, difficulty breathing. If they're exhibiting cold, symptoms, forcing the fluids, and just say hydrate, hydrate, hydrate. And I'm really trying to get them to avoid the emergency room because of what the lady said there, is that I might be exposing my child who might just have a cold to actually the H1N1. So I'm really zeroing in on vigilance, 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 and take them to the emergency room if they're exhibiting lethargy, poor color, increased or persistent fever. You can't control it. Other than that, stay home with the baby. I had one mother, she had twins that are like 10 months old. One did come down with it. Kid had to get the Tamiflu, but the other kid did not. She kept those kids separated, and the other child so far has exhibited no symptoms, and neither has the other child.
It's interesting that you should mention having to change your work habits and doing certain things over the phone. That takes me to a question with you, David, because you talk to businesses about maybe changing the way they do things. What have they been telling you just in the last weeks? Have they been able to prepare for this?
Some businesses have been very wise in their preparations and have made plans in advance. Some have not. Some have delayed, unfortunately. Our organization has been in existence for 3.5 years, and we've been trying to educate the public, particularly the business community, about what steps they need to take. So recently, we've been hearing that more and more schools are being closed, more people are being affected, more people are being sick. As Jeff said, there's more people are getting it, and we are very concerned that the worst is not here yet. So we are encouraging businesses to take whatever steps they can to keep sick people away from work, to keep well people separated, to take steps in the business place to sanitize the work surfaces, do whatever they can do to avoid the spread of the flu. And most importantly, the way to avoid dying from the flu is not catching the flu. The way to avoid catching the flu is to get vaccinated. So it's crucial that people get vaccinated as soon as the vaccine is available.
And of course, we're talking about dealing with 2 separate strains of flu this flu season. We have some information courtesy of the St. Louis County Health Department on both kinds of the flu. First, the seasonal influenza, which 5 to 20% of the population across the country contracts each year. As a result of that, more than 200,000 people end up being hospitalized from complications that stem from the seasonal flu virus. About 36,000 people across the country actually die. Now, some individuals, including the elderly, young children, and people with certain health conditions, are at high risk of complications from the seasonal flu. Then we have the other strain, which is H1N1, and that is spread in exactly the same way as the seasonal flu. It is spread through droplets, respiratory droplets, where you're coughing or you're sneezing. Very often people, and we're told you're not supposed to do this, but they often do it into their hands and then end up touching their mouth, nose, and eyes without washing their hands, and often that is the way that both H1N1 and the seasonal flu virus ends up being spread.
Are they touch a doorknob? Are they touch an elevator button? Are they touch your pen or your telephone? And then you touch it. So even though you haven't been infected by it, the person who was in the restroom before you or used the door before you or the elevator before you may very well have just sneezed into their hand. So you need to be very careful what you touch.
Well, it's just like some of the women in Anne-Marie Berger's story said, people are laughing at me because I'm using a tissue to open the door.
Good for her. Good for her.
Yeah. I've got a question for you, Dr. Lowell. Now, as far as the H1N1 virus is concerned, they're saying that pregnant women, young people are very susceptible to that. What is it about H1N1 that makes it so dangerous for young people and pregnant women?
Well, most haven't been exposed to this type of virus before. There's a variety of different species of virus, and most of them we see every year. But this one is totally novel. It came originally from the pig. That's why it was called the swine flu. So these people, young people especially, haven't been exposed to anything that looks like this before. Now, the good news is it's not as virulent as it could be. The bad news is it is still virulent, and so we're very concerned about it.
Now, one thing, I was talking to the St. Louis County Health Department yesterday. They are expressing a concern for seniors because the production of the seasonal flu vaccine has stopped because they have to start now ramping up for H1N1. What are all of you hearing as far as the number of elderly people who need to get vaccinated, those who have not been able to get access? What have you been hearing about this?
Well, it happened early. I mean, the seasonal flu vaccine happened at least a month, 6 weeks before it typically does in anticipation of trying to gear up for H1N1. The best knowledge I have right now is most of the seasonal flu vaccine in the St. Louis region is pretty much gone. So that the preventive measures that we've talked about earlier in terms of washing your hands, staying away from sick people, is going to be even more important for those people who are typically most susceptible to traditional seasonal flu vaccine.
Jan, I was wondering, in some of the homes that you visit, I didn't know if you have like multi-generational, like 3-generational, where you have a grandma and a child, all of whom are at risk. Are you seeing a lot of that?
Yes, I have. Like the situation I just talked about, where it's the mom, the twins, a stepson, and then caregivers, because this mom is also, the father works as a barber, so he's exposed. The mother is works, she's a student, and so it's coming in. But yes, I do see a lot of multi-generational. And one of the things I was just talking about, with my colleagues, is that I've been in homes where there isn't hot running water. So hand washing can be a little bit of a trick because it's cold. So they have to heat they heat the water for bathing and for cooking. But I always stress, the hot running water, 15 minutes, to do this, to really wash and drown the germs away. And I'm coming across that as another one of my barriers. We are giving out tissues. We have asked for, Nurses for Newborns, has received donations, and we are giving out boxes of tissues. We have received hand gels. We're trying to get this out to the families. When I do visit a family that looks like by triaging the phone that, I may not be able to come into the house today, but I triage, here's the thing, is that I will stop by the house and we're trying to leave like little flu boxes by the door with tissues and gel, that sort of thing to try and instructions, on this is what you need to do. and this is what you need, how to protect yourself and how to keep it from being spread.
I like the idea of a flu box,
Like
and we encourage families to create their own disaster boxes, which would include medications for a month or so, food that they can cook, pet food that they need, whatever they're going to have to use, so that they can, and water, plenty of water, so that they don't have to leave their home if they are sick. If you're sick and you've got to go to the grocery store to buy food, then you can't avoid coming close to other people and potentially infecting them. So what we encourage people to do is, and what many people do is, next time you're at the grocery store, buy a couple extra cans of things or buy a couple extra bottles of water and just stockpile them so they're there. Not so much that they won't be available to you, but that you won't have to go out and get them. Fortunately, this H1N1 thus far has been fairly mild in the length of time that people are sick and the severity of the illness. But that doesn't mean they should jump to work. I was sorry to hear the person in the story earlier saying that she had to go to work. I understand that. But what she's doing is potentially infecting dozens of her coworkers. And that's just not fair to the coworkers. It's not fair to the business. And she wouldn't want someone ill coming in to her and infecting her. So it's just, it's difficult, but please, we encourage people to stay home if you're sick. Avoid other people.
Okay. If you're just joining us, you are watching a Living St. Louis special called Living with the Flu. We're having a discussion with Dr. Jeffery Lowell from Washington University School of Medicine, David Reddick from pandemicprep.org, and Jan Polizzi from Nurses for Newborns. If you need help finding resources in connection with flu prevention or treatment, call the United Way's 211 service. Now we need to talk about the vaccine. A lot of concerns have been raised. First, when is it going to get here? What is the latest?
I was speaking to the St. Louis County Health Department this morning and was told that 33,000 doses are going to be here today or tomorrow. So those will be available. That's certainly not enough for this week, but they expect to get more perhaps next week. And I understand that the production is finally to the level that they hoped it would be earlier. So hopefully within a matter of several weeks, there'll be plenty of this vaccine available. It's too early to put a definite timeline on it, but we know that 33,000 doses are here in the county now, will be made available through various caregivers and other groups. So if somebody is concerned about this and falls within that priority area you talked about, they should contact their medical advisor, their physician, or their nurse, and find out, and confirm that they are in that priority area, and find out where that vaccine will be available. Because it's going to be available very soon. Not as much as we need, but more than we had.
And let's talk about that vaccine distribution. It will, because when the vaccine does arrive, there are certain people that get to go to the head of the line. They include pregnant women. They are among the Tier 1 priority groups, healthcare workers and EMS workers. Then there are children and young adults between the ages of 6 months and 24 years, and caregivers for infants are another group, and adults aged 25 through 64 with certain medical conditions that will put them at risk for influenza-related complications. Now, in Anne-Marie's story, again, a lot of these students of hers were talking about stuff that everybody's talking about. There are concerns about the vaccine itself. They feel that because there is this big rush to produce the H1N1 vaccine, that somehow it might not be as safe. Some parents are concerned about the mercury preservatives, mercury-based preservatives. What would you say to those people?
Let me take one at a time. So this vaccine has been produced in the same way by the same manufacturers as the seasonal flu has been produced for the last 40 years. No differences in how it's produced. So I think the concerns about the individual production of this vaccine should be put to rest, because it's the same as all of the seasonal flu, which is an extraordinarily safe vaccine. The issue of the inorganic mercury, or the thimerosal, that's in minute quantities in the multi-dose vials of the vaccine, has also been studied exhaustively. So far there has been zero scientific evidence to link it with any problems or concerns down the road that people may have. However, for those people who still don't want it, there are two types of flu vaccine, both the flu mist, which doesn't have the thimerosal in it, and also the single-dose vials, which may be more difficult to get.
Okay. And for those individuals who just say, no way, no how, because there are always going to be a few people who just aren't going to take any vaccine. Hand washing, any other advice?
Well, hand washing, frequent hand washing, hand sanitization, and stay away from me.
Yeah. Okay.
I agree.
Okay. One of the things I do is I try and tell people avoid crowds. I mean, they do have to go out and shop. How are you going to tell somebody to put out a disaster box of emergency food if you're not going to go to the store? So I do encourage them that if you are shopping, try and shop at times when the stores aren't so crowded. Take your hand wipes with you so you don't be touching the counters. Get your shopping done when there's a little bit lower volume. But one of the problems that I have with the families that I'm serving is that it is transportation, is that these folks, they may not have cars, they're going on the buses. It's hard to carry a whole week's worth of food, and also financially they may not be able to budget, 7 days of food in advance for an emergency. They're living day to day. And so I'm juggling that sort of time budgeting on access issues. One of the things that Nurses for Newborns is planning on doing is that we did receive a grant from Emory University along with a coalition of our partners with Maternal Child Health and Interfaith Partnership that we can provide some transportation access working with some of the churches to have at least 600 pregnant women get immunized, and we could be helping out with providing the transportation services by locating them not just to the clinics but maybe in their own churches and having identifiable sites where they feel safe. So the nurses from Myrtle Hillier would be going maybe to a church or a site which would be closer to the population because we do have access issues.
And Ruth, for businesses which may not have any idea what to do, I know that on your website you link to pandemicprep.org's website, and we have some templates there for planning for pandemic, figuring out ways that businesses can look at their HR policies to see if those need to be changed. So we encourage businesses to think about it too. I was very pleased to see that at your studio here, in the restrooms, there's a place to dispose of the hand towel right by the door. Mm-hmm. In many restrooms, you can't do that. So you can't open the restroom door to leave and throw away your hand towel without carrying it around with you. So simple things like that. Businesses can put a wastebasket by the doors of their restrooms and encourage people to use the hand towel to open the door when they're leaving the restroom. Simple things can be done to help stem the spread of this virus. And more complex things, perhaps they need to change their human resources policies so that people will get sick leave. If somebody comes in and is sick, they need to be sent home. And many businesses don't have that capability currently. So we encourage businesses to look very carefully at their human resources regulations and guidelines and perhaps change those. We also encourage them to think about working from home. Many employees can do what they do from home using the internet or the telephone. So we encourage businesses to be thinking about that in advance.
And we happened to be at one of your meetings last month where that was one of the topics that was being discussed. We happened to take our cameras there. What I'm wondering is, if this pandemic gets worse, are you going to be meeting more often?
Well, as a matter of fact, our next meeting is a webinar. We're not going to be meeting next month. We don't have a meeting schedule. We are scheduling a webinar for anybody who wants to sign up. They can go to our website and sign up the week of December 2nd. For that very reason, we are concerned about bringing people together who may inadvertently infect one another. So the steering committee of pandemicprep.org has thought long and hard about whether we need to stop doing public functions for a while. And at least for the next event, it'll be a webinar, not a public function.
Do you think people ought to think twice? Because the holiday season is coming up, Thanksgiving, Christmas, a lot of people jump on airplanes. Should they reconsider or just take a face mask and hope for the best?
Boy, I don't want to be the vice president here. It's, as you know, the vice president made a comment that was really kind of untoward. I just think you need to be very careful who you allow yourself to be exposed to.
Okay. And actually, the face mask does not protect you from the outside. The face masks that are recommended is for a person who has maybe been afebrile for more than 48 hours, and if they do show up to work, they're the ones that are wearing the face mask, not the person who's trying to keep themselves from being infected. The one who's trying to keep themselves from being infected is the person who is using their hand wipes, sanitizing, wash, and staying at least 3 feet away from people. I just tell people, try and avoid crowds. Try and keep your airspace. That's why I'm saying try to shop, where there's less crowds, and being careful what you touch.
Okay.
The other thing we've done is we've cut back on meetings at work, too.
Very good.
Is that we have the first one into the meeting room is wiping the table down, the last one out. We have the wet wipes, to wipe things down and to clean the doorknobs. But we've also reduced our meeting times at work.
And I'm going to have to let that be the last word, but I want to thank you so much for joining us, Dr. Jan, David. It's been very informational.
Thank you for this station for taking the lead in this. I think it's a great public service that you're offering to the community.
Thank you.
And before we leave you, a note from the pages of history. In 1918, what was called the Spanish flu took the lives of some 50 million people around the world. During the early stages of the outbreak here in St. Louis, the public health response was swift. Officials ordered the shutdown of schools, churches, and other places people gathered in large numbers. Individuals who came down with the flu were quarantined in their homes. As a result, the rate of flu-related deaths was limited to 347 for every 100,000 people. Now compare that outcome to Philadelphia's, where the response was slower and where officials allowed a citywide parade to take place even as the flu virus was raging through the population. Philadelphia's death rate ended up more than double that of the gateway city. The 1918 influenza pandemic was the deadliest of the 20th century. Medical researchers say lessons learned about not getting or spreading the flu remain relevant today. And that's tonight's Living St. Louis. Remember, if you need help finding resources in connection with flu prevention or treatment, call the United Way's 211 service or log on to KETC.org. Good night.
Funding for Living St. Louis is made possible through the Mary Rankin Jordan and Eddie A. Jordan Charitable Foundation and through the generous support of the members of KETC.